Hello, everybody. Hello, everybody.
Hi.
This is Dr. Vinay Sundar from AV's Maxillofacial and Dental Talk. Today, I have with me Dr. Lirin Ann from Malaysia. And Lirin, can you just give me a short intro about yourself?
Hi, everyone. Thank you so much, Vinay, for having me today. To briefly introduce myself, I'm not a Malaysian. I'm actually an Indian who's working in Malaysia, just to clarify.
Okay.
Like when you had approached me asking me for opportunities for dentists to apply in Malaysia, I thought I'll just explain like how an Indian graduate can apply in Malaysian institutions for a job. So I basically completed my bachelor's and my post-graduation from Savita Dental College. So I graduated in 2011, my BDS, and then immediately I enrolled for my MDS in Orthodontics. Okay. So I finished around 2015, and for a year or so I was working in Chennai itself, also in Savita as well. So I was working for a couple of months as a senior lecturer there. And then I heard of this opportunity, and then I shifted from Chennai to Malaysia.
Okay. The first question what I'm going to ask you is, why Malaysia? What is so nice about Malaysia that you wanted to shift there?
Well, it's a very beautiful country. I mean, most of us don't know much about it. Like, I never really planned to go to Malaysia as such. I did have plans to, move to Middle East because I was planning on, applying in, clinics or clinical practice in Middle East as such. So, at that point of time, I guess I didn't really get much of opportunity, like job opportunities from the Middle East as such. And then around the same time, I had a few friends as well as a few contacts who were working in Malaysia. So they like kind of informed me like how this place is, and it's a really beautiful place, and people who are like looking for starting their career, and you want like a good experience, you can very well apply to this country.
Okay. Since you are from Savita and I am from Ramachandra, you have a lot of friends who are from Malaysia, and they come here, study for 5 years, and we know what their protocol is, right? They go back and they have to work for the government for 2 years, and then they have to get the license to practice. Now, what is the route for an Indian-based person who wants to go and get a license in Malaysia? And I think that's what you are doing currently, right?
Yeah. So basically, how I just tell you how I did things.
Okay.
So I finished BDS in Savita as well, and I finished my post-graduation as well. So the job opportunities, like you have to search, like you have to have a platform where you look into, where they give you advertisements where they're looking for, orthodontists or specialists to work in Malaysia. So that's how I came across, and word of mouth, like somebody informs you, okay, there's a vacancy here. Do you want to apply? Are you interested? So those kind of ways is how you get to know that there is a job opportunity to apply to. So like that, when I was working in Savita, I got a information that one of the institutions in Malaysia, it's a university. Okay. So basically what I want to say, clarify here is I'm not doing a private practice.
Okay. I think that
I'm actually in a private institution. Yeah. But I'm not working as like a consultant, or I'm not having my own clinic here. So I just want to clarify that, because you're not allowed to have a private practice in Malaysia unless you're a Malaysian citizen. So I think there's a whole different protocol, like how we have Malaysians to please. Yeah, so that's different. But for a foreigner who's coming to Malaysia, you will have to go through an employer. So my employer is an institution here, which is the private institution in Malaysia. I'm working in that institution. So when I heard of the opportunity to apply in the institution, because they had a vacancy for dental, they were taking dental graduates for, I think they wanted number of, increase the number of dentists. So they wanted more dentists to apply. So like that, I heard of the opportunity and I applied for it. So one of the first things that they ask you is how many years of experience you have after you have graduated. And what you need to remember is when you finish your BDS and suppose you've done your post-graduation as well, in Malaysia, they don't really consider your post-graduation as a postgraduate. Like you're not considered as a specialist. You're working or you're employed first as a dentist. Okay. So you're like a GP here, and your PG, that years that you spend as doing your PG, they will use it as your residency. Yeah, so that's how they basically hire you in. So in institutions. So like that, when I heard of this, I kind of wrote to them, like I sent an email to the HR. So every institution, they'll have a website. You can log into the website and you can see there will be an HR portal. So sometimes they'll have their own forms of how to prepare your CV. You can use that, or you can have your own format, and don't believe in, really colorful CVs or anything like that. Just give us straightforward, genuine details, and make sure your dates are correct and you don't make any mistakes in your CV. And you'll have to attach and send them your degree certificates and all that. That is after your foreign attestation is done. So you have a different, when you're applying to foreign countries, you have to attest your degree certificate from the foreign affairs. So all that should be done when you're applying for these jobs. So what I did was I emailed them my CV first, and I got a reply from them back saying that they're interested in conducting an interview. So that's the first reply I got from the institution. And after that, they communicated with me a time slot, like an online interview sort. And we had a interview session. They were quite happy, but they'll reply not immediately, maybe in a day or two, like that. You have to give them some time. So I got a reply from them saying that my my resume has been accepted. And I just went ahead. Then whatever processing has to be done, you're basically tied up with one of the people in the HR who works at that institution, and they will coordinate with you of what documents you need. So that was the time when I started with the attestation work, and all these foreign affairs attestation, the Malaysian consulate attestation, all that work. So your degree certificates, your mark list, your your BDS and MDS, both you have to send. And they will also require your experience certificates as well. That is either from, suppose you're working as a consultant or you're working in your own private practice, then you have to get a, like a certificate sort of stating that you've been working here. So that should be genuine, because they will cross-check your work experience and all that.
So even if you're not working in the institution, if you are in private practice for 3 years, either as your own practice or under somebody, you still need a experience letter from that person.
Yes, because you have to show them that you have so many years of experience. It doesn't have to be like they say a minimum of 2 years, but what, like for me, what happened was I had just worked for a few months in Savita. So my experience was calculated from 2011 onwards.
Correct. Like, from the time you finish your BDS, right?
So my PG years, everything was calculated as my experience. So like that, they will, guide you into how you have to. But when you produce your certificates, you have to give your MDS as well. It's not that you don't have that. So that's how they process.
Does it really? I know that you've told that BDS. I mean, the number of years for experience count from the time of your BDS. Now, since you're an orthodontist, does it make a difference since you're an orthodontist as far as when it comes to applying for this job?
Well, see, actually, they do require specialists when they work in the institution, but it's like the government's requirements are like your minimum qualification is your BDS has to be done. So it has to be like, so an extra information is now, suppose when you join back here, like when you start your work in the institution here, so if it's a recognized institution by the Malaysian Dental Council, it is easier to get your practicing license and your teaching permit. It's much easier. Whereas if it's an institution that is not, recognized by the Malaysian Dental Council, then there's a different procedure for it. But not that you cannot apply, you can apply. It's not that you shouldn't apply, you can.
So once you're tied to this HR, right? You say you're tied to a particular person in HR. So do they help you in processing all the visa also, or that has to be done separately?
Yes.
And did you find any difficulty in processing the visa?
Well, actually, it depends on the HR and the immigration, whatever your documents, everything that is being processed. So what happened with mine was that I always had a communication with one person in the HR, and they kind of kept informing me as what documents should be ready next and what needs to be submitted. So they give you like a checklist. So for your visa as well as for your teaching permit, like what are the documents required for your teaching permit, what is required for your visa processing. So that checklist, you just have to keep, getting all the documents ready. Once it's ready, you send it across to them. It's not that you have to send a hard copy. You can just scan and send the mail, and they will do the necessary requirements from their side to the immigration services to process your visa. So the initial thing is like, since you're a foreigner, when you come into the country first, it's a single entry visa. And then it is, once you enter the country, then they change it to a multiple entry where they stamp your employment pass in your passport. So that's how, so you're under contract with the employer. So they will stamp it as a whatever, how many years validity. Suppose a minimum contract is like 2 years, then you get a 2-year employment pass with the Malaysian immigration.
So it's basically, checking your paperwork, and that has to be processed by the respective institution. And usually when people go to abroad, right, usually I'm talking about US or UK, they have to write this TOEFL or GRE exam. Did you have to go through something like that?
No. So basically in Malaysia, they accept our BDS dental degree. So only in countries where they don't accept our degree, you have to give a licensing exam. But, rules are changing, in near future. So you might have to give an exam, but it would be quite easy because BDS is accepted here. So it's pretty much the same as how you would give licensor exams in other countries. So right now, you don't have any licensing exams. For working in an institution, like educational institution, you don't have.
Okay. Now, the thing is, like, when we move on to any country, so now you have become as a faculty as well as a consultant in that institution, right? If I'm not wrong.
Yeah.
The faculty as well as an institution. But when you move...
So I'm a lecturer here, as well as there's every university will have a small dental clinic attached so that students learn with their patients. So yes, you do have to be a consultant because when you guide students or sometimes they're not able to do, so you have to step in. So in that way, yes, you're considered as a practicing dentist as well as a lecturer. So you have to do both because you have practical as well as lectures.
So when you move from India to Malaysia, this happens in almost anywhere when you move to any other country. So will be slight changes in the treatment protocols, standardization of the procedures, diagnosis. I mean, diagnosis, not much of changes. I'm talking about how you approach a patient and all that. So did you have to go through some training or something like that, or it was pretty much same as whatever we follow in India?
Okay, so basically for my with my experience, since it was a few months in Indian institution, and when I came here, when I switched to a Malaysian institution, the curriculum is quite different. So definitely the first 1 month, you are trained by the dean, the faculty who are already at the institution. They will definitely give you like a training, not a training per se, like they'll brief you on what is the curriculum and what is the requirement. So here the system is kind of different from the Indian system because like if you say, yes, your BDS year 1 to year 5 you have. Like normally in Indian institutions, year 5 is basically an internship, right? But here in Malaysia, you have to enroll, like it's BDS year 1, year 2, year 3, year 4, and year 5. So year 5 is when you finally give exams and graduate. So each institution has their own curriculum. Like they have to follow certain standards that is given by the government. You have to fulfill those requirements, but you can design your own curriculum around those rules. So the institution that I'm working in right now, they have a different approach, like more of like integrated practice. Like, you have comprehensive dental practice, and they give more importance to polyclinic systems and things like that, because that's how it's emerging. So they kind of update their curriculum to the standards followed internationally. So you have to, keep up with that. So I didn't require a separate training per se, like, just because I'm from India and that sort of a thing. But they will brief you on the curriculum. What is your, your requirements? They will tell you all that. It's nothing that you need to learn beforehand. But yes, you do have certain requirements. Like you should know how do you, do a comprehensive dental care, or how do you teach a student to apply certain knowledge, those kind of things, like something related to your teaching capabilities, they will ask you. Even during an interview, they'll ask you that.
Okay. And so now you're a consultant as well as a faculty, so I'm sure you'll be in, guiding students and all that. So do you get to treat patients under the institution, like patients coming to the institution?
Yes.
You have the license to treat them, but you don't have the license to treat patients on your own outside. as a private practitioner.
Yes, you're right. So basically, I can treat a patient, I can do all the treatments within the institution clinic, but I cannot go outside and do a private consultation, or I cannot set up my own private practice outside the institution. So I can work within the dental practice inside the institution. So I do my patients as well as guide students with their cases.
That's nice, actually. That's a good thing to do. Now
Yeah.
you're an orthodontist, so you go to the ortho department. Okay. Suppose
Yeah.
there's a person who has not had any specialty, finished his BDS from India, okay, and say he has 3 years of experience, probably working in an institution or in a clinic under somebody. So does he get to choose his department, or does he get to perform procedures like what you do, or how does it work? I just want to know.
So basically, what happens is like you in my institution. I'll just tell you what's happening here.
Okay.
So anyone who's hired, like even though I'm hired as an orthodontist, I'm working as an orthodontist, and I'm teaching orthodontics and all that. But if suppose a situation arises where I have to go and see a complete denture case, or I have to go see an RPD case, I should know all my basics.
Correct.
So it shouldn't be that I say, no, I'm an orthodontist, I cannot see. No, you cannot. So that's depends on the institution rules. Like each institution has their own way of, hiring people. So that's different. But normally in all institutions, when they hire you, they will tell you beforehand that you have to be available to do all the procedures. But you do, if it's beyond your capacity, that means if you don't know, like suppose I'm not too well versed with doing a molar RCT, or say I'm not too well versed with doing an apicectomy, I don't have to do it. I can always call another doctor or refer, but you should know when you have to refer. You can't just do the procedure, make a mistake, and then,
Absolutely.
So yeah, so you cannot do any trial error, because here I think one of the main things I find the difference is you have medical legal issues. When you treat a patient, you have to be careful, which is not so much stricter in India. So you don't really have that problem. But when you're working in a foreign country, any country for that matter, medical legal issues come into play. So you have to be careful of what kind of treatments you do. But that doesn't mean you have to be scared about every procedure. Like, you have the leeway to do the procedure, just don't, harm the patient. That's the main thing.
And you have any updates, or do you think are there new laws or rules becoming where you can actually become a private practitioner or go as a consultant? Is something like that coming up anytime soon in Malaysia? Because,
yeah, so in the near future.
Because when I spoke to other countries, right, like say the States or UK people also, they are all allowed to have their private practice, just that they have to go through a series of exams or interviews. So is there similar something popping up in Malaysia? I just wanted to know.
Well, probably in the near future, there will be a mandatory licensing exam, even for those doctors who are applying in institutions as well as private practice. Like, it will be like a board exam for all dentists who want to practice, whether be it a university or a private clinic, you have to give exams. But that is coming probably another 5 years or 6 years down the line. We're not sure yet, because it's still being in the process of implementation. But yes, you do have I've heard that very soon you can get your specialist license, which is something which you can use if you want to go outside and consult. So right now I don't have a specialist consultant license, which is why I cannot practice as an orthodontist outside. So it's legal for me to go out and practice as an orthodontist, because I don't have my, like a specialist license, which you have to get it from the Malaysian government here. So that will be soon, it will be implemented soon, because they will require, specialists to work in, whether be it an institution or outside. So you will require a licensing.
Did you have any processing fee to clear your documents or something like that? Just
well, you just have the processing fee for your foreign affairs, attestations, all that, which is done by you, that the employers will not pay for. And your visa
for the same, so that viewers can just get to know how much they need to.
I think when I went, it was around 400 rupees, like that, if I'm not wrong. I think the attestation was
Indian rupees.
Yeah, I think it was. I'm not very sure, because I remember this.
So it's not very expensive, right? It's not something very expensive.
No, it's not.
Okay.
You won't. I mean, you won't have much of expense. Even in the Malaysian council, they don't. They charge you only for attestation by the consulate. Yes, you do have to make a payment at the Malaysian council, which they will give you a receipt and everything for. Okay. And that I think was some 200 ringgits. I mean, 200 rupees like that. Not much. You won't have much of expense. After that, your visa paperwork processing and all, it's done by the employer. So in my institution, like mine was a private employer, so they took care of all my expenditure for visa processing, everything. And the only thing was I was asked was to deposit $200 in the beginning. That is till I reach here, and that was the only clause that they had. But once you're done with the first 6 months, they refund that amount to you. So it wasn't a problem per se. Not much of expenditure, I won't say.
Okay. And as a faculty, are you provided accommodation? Just I'm asking.
Yeah, so it depends on the area where you're applying. So there are certain institutions which apply, which are situated more towards KL, Kuala Lumpur side, and go towards the city side. So some institutions don't have the facilities to, have an apartment or anything within the institution. But well, for me, I have. So my institution is like, it's a huge campus. It's a beautiful campus. So we do have apartments where we are given like 2-bedroom, 3-bedroom houses. Like, it's not a sharing accommodation. It's an individual apartment that you get. And you can, very well, easily transport from your, home to your workplace. It's like walkable distance, probably just takes about 10 minutes. Or if you go by car, just takes about 5 minutes like that.
Okay. So thank you so much, Lirin. That was quite a lot of clarity. But before I conclude, is there something you would like to tell the people who want to apply to Malaysia or something like that? Something which I have missed while asking or something?
I would say that, don't have any prejudice against any country. Like, don't have any set views that, I shouldn't go there or I shouldn't go here. Try to find out more information as to what you want. Like if you're interested in academics, like you want to be a lecturer or you want to do, teaching as your main practice. Okay. Like for me, I wanted to do clinical as well as teaching. So this was like perfect for me. Why? Because I got through both. And it was just like, yes, as an orthodontist, we prefer clinical more than teaching. But lucky for me, it's like, I have both. Like I have to teach orthodontics as well as I can work as an orthodontist. So it's an added boon. And you never know, like there are a few countries which accept our BDS without a licensing exam. So one of those countries is Malaysia, where you don't have to give a licensing exam. Okay. You can just come in and you can start working, and it's not too strict. The place is beautiful. You can travel around. You don't have to worry about so much of living expenses. The cost of living is also quite maybe high in the main cities, but as you move away from the city, it would be kind of manageable. You can okay. manage your expenditures. You will have savings. You do have tax that's there. It's not like the Middle East where you don't have tax or anything, but yeah, now it's changing even there also. But yeah, well, here you do have tax and everything, but even then you still have a good environment to live with your family. Like if you're just starting out, or you're not married, or you're single and you are just starting your career, you can definitely think about Malaysia as a place, because it's quite I would say the people are nice, and you don't have to worry about the language, because most people here know English. Okay. So you don't have to, learn the language Malay, although it's appreciated if you learn the language. The people really appreciate your effort if you learn the language. But they're very nice people. They're very down to earth, very welcoming, and they don't treat you as, hostile or anything. Yeah, so they really welcome foreigners, and they're very, very adapting. And I think another plus point for us as Indians is the food. You do have the option, because we have 3 races here in Malaysia. So you have the Malaysian, you have the Chinese, and the Tamil Malays as well, the Indian population. So you do have options with, you don't have to worry about the food and the living and all that. So it's quite, you'll easily adapt to the place is what I want to say. So don't think that, it's a foreign country, it's, how it's going to be. Like, don't have any ideas about it already. Find out more, I knew, because I had friends here who are already working. So I kind of had an idea of how the place was, and I visited KL before I joined here. So I'd come on a holiday, so I kind of knew the place, and the weather's beautiful. It rains throughout the year. You have sun and rain. It's not too cold. Yeah, but it's a really nice place. Yeah.
Thank you, La. And
Yeah. Yeah,
there's so much of
that's the only thing that I didn't get yet. Yeah.
Really, I know I could say there's a wonderful clarity in whatever answers you give. And is it okay if I can share your email ID at the end of the video so that if people are interested, they can contact you through email? Is that okay with you?
Yeah, sure, you can. I'll just share it to you. You can put it in your.
Sure. I can do it. Thank you so much, Lirin. It was really wonderful talking.
Yeah, thank you so much for having me. I'm sorry. I don't know if I was clear enough, but hopefully your viewers do have.
Perfect. Absolutely perfect.
Yeah.
Thank you, Lirin. Goodbye and all the best for your future endeavors.
Thank you. Good night. Bye-bye. Take care.